Hi, I'm Anna Kelly, clinical psychologist at the Emotional Health Clinic here at Macquarie Uni. And today's MQ Health Wellness Series talk is on adult ADHD. Years ago, it was believed that children diagnosed with ADHD symptoms actually grew out of them when they moved through into adulthood, but that's clearly not the case. Awareness of adult ADHD is continually growing, and I feel like I'm hearing about it everywhere at the moment. It might also be the case for you. Perhaps you've come across people talking about their diagnosis of adult ADHD on social media, or you've heard podcasts or people talking about it, and something about it resonates for you, or perhaps for someone in your life. Today I'm going to give a brief overview of what adult ADHD actually is, the impact it can have, assessment, and also treatment and supports. So let's start off with what is actually ADHD. So the DSM-5 defines ADHD as attention deficit hyperactivity disorder. Basically, aspects of an ADHD brain work a bit differently to a neurotypical brain. There are some things that are definitely more challenging, particularly in certain environments, but there are also incredible strengths associated with adult ADHD. Okay, so within ADHD, there are actually three subtypes. So the first is predominantly inattentive presentation, and this is what used to be called ADD. The second subtype is predominantly hyperactive or impulsive. And then there's a third subtype, which is a combined subtype, which includes both inattentive symptoms and hyperactivity, impulsivity symptoms. So you can see on the slide there's some examples of what, on the left-hand side, what inattention can actually look like. It might be mind wandering, difficulty sustaining attention on something you want to sustain attention on. The converse of that is actually people with ADHD often are really good at attention, but putting it on lots of different things. It might be overlooking or missing details in work or important tasks, difficulty organising, time blindness, difficulties with time. Inattention can also actually affect people socially because it can be quite difficult sometimes to follow conversations, particularly in a group environment or in loud or noisy environments. And I think often too, people describe really disliking or trying to avoid tasks that require long sustained attention. And then there's the classic tendency to lose things or forgetfulness. And then in terms of hyperactivity, impulsivity, you can see there some of the things that actually can look like in life. It might be fidgeting or restlessness. It might actually be an inner restlessness too, not necessarily external. Often people describe feeling easily bored or just not interested in tasks that are not particularly stimulating, or there isn't some novelty aspect to it. And then what's often commonly known is that tendency sometimes in social situations or interpersonal to kind of act and think sometimes before thinking things through. But I think what you'd find is most of us could relate to some of those characteristics at some point in time. So that doesn't mean everybody has a diagnosis of ADHD. For a diagnosis, what we need to see is a persistent pattern of those difficulties. And the difficulties need to be currently significantly interfering with a person's life. And also another key criteria to meet diagnostic criteria for ADHD is that the symptoms need to have been present before the age of about 12. So not diagnostic, but there's lots of other things that can be associated with ADHD, including a low frustration tolerance, emotion dysregulation, and hypersensitivity to criticism. But we'll talk a bit more about that in a moment as to some reasons why that might be the case. So why consider diagnosis in adulthood? For me, I think it's about that self-awareness, understanding yourself. There's a great title for a book that's been written recently by an Australian journalist who was diagnosed with ADHD in adulthood, and it's called The Year I Met My Brain, which I think is a really nice way of describing what it can mean to actually understand your brain and the way you think about things after having gone so long not really understanding why. And then my hope is that that self-awareness can lead to self-compassion. So many of the adolescents and adults I work with ADHD are just so hard on themselves, and also they've experienced an awful lot of criticism. The stats are quite extraordinary of how much negative feedback and criticism a child growing up with ADHD actually gets. So understandably that can have a really big impact on self-esteem, and that false sense or being told that they're lazy or unmotivated or not intelligent, which is completely wrong. As well as the difficulties, it's equally important to highlight, though, the strengths of an ADHD brain. Both their unique individual strengths of the person, ADHD is not all they are, but also the strengths of ADHD itself. I mean, I've just listed a few there, but the creativity, the thinking outside of the box, problem solving, the hyper-focus on something that's of interest to the person, as well as the spontaneity. So there's certainly strengths, but it's really, really important not to underestimate the actual difficulties in day-to-day life that ADHD can cause. Okay, so how do I know if I need to seek an ADHD assessment? I think that most adults who are seeking an assessment for ADHD are doing so because there are significant problems that the ADHD symptoms are causing in one or more areas of their life. You can see on the slide there some examples of some of the most common problems that people might be experiencing that lead them to seek an assessment for ADHD. Inconsistent performance in jobs and careers, underperforming, underachievement in relation to the person's actual abilities, difficulty with day-to-day responsibilities, relationship difficulties can often be a factor. And I think one of the two on the bottom there are really important, and often people might seek support for stress, worry, or feelings of frustration and guilt, and not really understanding that actually underlying that can be undiagnosed ADHD. So how do I go about getting an assessment for ADHD? It's really important to see a professional who can make a differential diagnosis. And what that means is they can work with you to identify and explore the potential symptoms of ADHD that you might be experiencing to see whether or not it is ADHD or whether it is perhaps something else. For example, inattention can sometimes be actually related to worry and rumination and anxiety rather than ADHD. The differential diagnosis with a professional is also really important because there's a lot of co-occurring difficulties that a person can experience alongside ADHD. Certainly higher rates of anxiety and depression, sleep difficulties, and some of the learning difficulties. So assessment and diagnosis is likely to include a team. First point of call would be your GP. Talk to your GP about the experiences, the symptoms you're having and the impact. A GP can then screen for any potential medical issues that are also present, and they're then going to refer you on to either a psychologist or a psychiatrist, or perhaps both in some instances. So you want to see a psychologist who has experience and training in the assessment of neurodevelopmental learning and mental health difficulties, given we talked about how they can be co-occurring. And then a psychiatrist obviously is a medically trained professional who has experience across a range of mental health disorders, and they're also going to be able to prescribe medication if that's part of the treatment plan. Okay, so looking at the two main areas within treatments and supports for ADHD. The first and probably most commonly known is medication. There are two main types of medication. The stimulants medications are the most commonly prescribed, and you'll probably know those names, Ritalin, and there's also the dexamphetamine, Vyvanse, which is a newer medication. And then if there's side effects with these, or perhaps it's not providing the benefit that you're looking for, or there's other co-occurring difficulties, then sometimes non-stimulants like Strattera or Intuniv are prescribed. But it's really important, so the medication can help with the core symptoms of ADHD while the person is taking the medication. It's a bit like wearing glasses like these for needing to read. So while you've got your glasses on, things look clearer, but you take your glasses off and my eyesight's the same as it normally is. And it's the same with ADHD medications. So they're helpful while they're in your system. So what's really important is also a psychological or behavioural approach that helps a person develop helpful habits and skills to manage some of the difficulties associated. So CBT is the most evidence-based and well-researched approach for supporting adults with ADHD. And working with an experienced mental health or allied health professional or an ADHD coach, CBT covers a number of different things. Initially, it's going to be information about ADHD, what it is, how it impacts people, and helping you with that self-awareness that I talked about. The next aspect that CBT can be helpful with is developing individualised skills and strategies to help with organisation, planning and time management, things like that. And the important thing there is that it's individualised, so it's about trial and error, working out strategies and things that work for you. And then another aspect that you would work with a professional is working together to identify ways to manage and change your environment. That might be to reduce distractions or to structure your home or your workplace or your study area in a way that is actually aligned with your learning style and your attention profile. So that's really important, and it's not going to be the same for everybody. So that's why it's really important to work collaboratively with the professional and really individualise any of those strategies. And then, as I mentioned, given that these often can be co-occurring mental health concerns as well as ADHD, working with a CBT or other therapy approach is important to support that too. All right, so the final slide has some links to further information which should also be available in the notes below the video. I hope this has been helpful and good luck.